Hey Ramya,
Yes.
yes, you can continue your session now.
Okay. I'll start from the
Please
beginning.
on
Okay.
your camera.
Good morning, everyone. Today, the title of my presentation is Effective Management of Phobic Disorders and Integrated Approach. As you can see in this picture, a lady is highly afraid of so many situations or objects. We can term it as different phobias, some irrational fears
Hello
she's
Ramya.
having. Hello?
Yeah, can you please on your camera?
Camera is not on.
You are not visible.
1 minute. Is it
Yes,
okay
now
now?
it's
Hello? Is it okay now? Hello?
she can continue.
Can I start?
Yes, you
Hello?
can continue your session now.
Okay, you want me to start from the beginning? I will start from the beginning.
Yeah, yes.
Hi all, good morning. Today's topic of my presentation is Effective Management of Phobic Disorders and Integrated Approach. As you can see in the picture, young lady is affected by too many irrational fears, which we term as phobias, different kind of phobias. That is the relevance of this picture. So what is a phobia? Phobia is refers to a group of anxiety symptoms brought by certain objects or situations. They involve persistent, irrational fears and avoidance of that situations or objects which induce these kind of fears. A specific phobia, formerly called as simply phobia, we used to say that lasting an untraceable fear caused by the presence or thought of a specific object or situation. So this is causing the person to endure an intense anxiety or nervousness or to avoid an object or situation entirely. So these are certain common types of phobias which everybody knows. I just referring again for your knowledge. The first one is agoraphobia. That this condition of phobia happens when a person is in a crowded place or a public place, attending a public meeting or something like that. Fully crowded place, they will feel panic kind of symptoms. There's tightness in the throat, pounding heart, severe sweating, feeling like they will go into faints, all those panic symptoms. Then another is social phobia. That is, a person is in a social situation. They feel high embarrassment or awkwardness because of this fear. Then next category is specific phobia, already mentioned in the previous slide. This is a specific type of phobia related to a particular object or situation. Example, fear of dogs, cynophobia. Then fear of heights, acrophobia. So what is the importance of treating a phobic disorder? Because it significantly impairs the individual's social or occupational performance. It affects the daily routine life of the individual. That is why phobias need to be corrected as early as possible. Some of the common specific phobias I am mentioning, just for your knowledge. First one, claustrophobia, already described. Fear of being in a constricted or confined space. Aerophobia, fear of flying. Arachnophobia is fear of spiders. Driving phobia, fear of driving a car. Emetophobia is fear of vomiting. Erythrophobia, fear of blushing. Hypochondria, this is a condition where a patient feels that they are becoming ill. The fear of certain undiagnosed illness. Always they thought that they are having some illness or other illness. Zoophobia is the fear of animals. Aquaphobia is the fear of water. Acrophobia, fear of heights. Then next one is blood, injury, and injection. BIA phobia. That is includes whatever the situation related with this syringes, needles, blood. Escatolophobia is fear of escalators, and tunnel phobia, fear of tunnels. Next one is panthophobia, fear of anything, everything. Pteromerhanophobia is fear of flying. Entomophobia is certain animals or insects mainly. Mysophobia is known very popular by the name germophobia or bacteriophobia. Every time there is a germ is there, a bacteria is there, that kind of fear is there. Then astrophobia is weather conditions such as thunder and lightning. Tyrannophobia is fear of needles. Geophyrophobia is crossing bridges. Claustrophobia, closed spaces. Autophobia is the fear of abandonment, that is being abandoned by somebody, some individual nearest to you. Hemophobia is the fear of blood, and dentophobia, fear of dental treatment. These are the common symptoms experienced by a patient while they are having phobias, any of the phobic disorders anyway. Sweating, abnormal breathing, accelerated heartbeat, that pounding heartbeat, trembling, hot flushes or chills, a choking sensation, chest pains, tightness in the chest, butterflies in the stomach, dry mouth, confusion, disorientation, nausea, dizziness, headache. Pharmacotherapy, usually what are the medicines we are giving? Mainly for the social phobia, social anxiety by FDA approved medicines we are giving SSRIs like paroxetine and sertraline. Then SNRIs like venlafaxine and SSRI, escitalopram, fluoxetine and fluoxamine. Then MAOIs like phenelzine. Then Remya, moclobemide. These are the common medications usually we are giving. Then for agoraphobia again SSRIs like escitalopram, that's the commonest medication we are giving. Then some of the tricyclic antidepressants like clomipramine, imipramine. Then cyclopam, fluoxetine, fluoxamine, paroxetine, and sertraline. It's already mentioned. And venlafaxine and reboxetine, and some benzodiazepines. Benzodiazepine, already you know, that is a sleep-inducing medicine we are giving for the patients who are lacking sleep. Mainly aprosolone, lorazepam, diazepam, and clonazepam. Then agoraphobia already I have mentioned. Next one is psychotherapy. That is the most important. Nowadays, we don't want to give a medication or pharmacotherapy to a particular patient. Either the condition is not severe. Otherwise, we can go for the psychotherapies, the counseling therapies, mainly CBT, cognitive behavior therapy is a fear fighter actually, and also behavior modification therapies. So these are the most commonly used therapies for top therapies mentioned for these phobic conditions. Then certain specific therapies we are usually providing the patients for this fear or phobic conditions. First one is systematic desensitization. This is a type of behavior therapy based on the classical conditioning. It's developed by Wolf in 1950s. This therapy removes the fear response of the individual. That phobia response is removed and is substituted by a relaxation response to be the conditional stimulus, gradually using as a counter condition. There are three phases in this treatment. First one is the patient is taught a deep muscle relaxation technique or any breathing exercise so that they can be easily relaxed. Second phase, the patient is made to make a hierarchy of fears from the least one to uppermost feared one, most feared one. So this is a crucial structure provider of this therapy. Third one is patient works their way up to fear hierarchy, lower level to higher level. Using their relaxation therapies. Whenever they are experiencing an anxiety, the patient is made to use that relaxation technique or breathing exercise already taught to them. So this client is upset, they can return to earlier stage. Once they are doing one therapy, reaches next hierarchy level, it seems that they can't go for the next level, then let them come back to the earlier step. Then again, we will make them do the relaxation, then again go for the next level. Likewise, we will do. The client repeatedly imagines or confronted by this situation until it fails to evoke any anxiety at all, indicating that this therapy is successful. This process is repeated while working through all the situations in the anxiety hierarchy, from least to most level hierarchy. So usually we are using 4 to 6 sessions, but in some severe situations, it will need up to 12 sessions. Next one is flooding. Flooding is also known as implosion therapy. This is a kind of exposing the patient to directly to their worst scenarios or fears. So patient is thrown into a deep end, but here we are exposing the sufferer or patient to a particular object or situation which is causing them this phobia, but under safe and controlled environment. So patient is safe, nothing will happen to them, but the anxiety will be aroused, the panic will be aroused. Initially, it will be extreme anxiety, then panic, then going for exhaustion, and finally relaxation. So comparing with systematic desensitization, which is an in vitro or imaginary procedure of stimuli. This is direct contact with the stimuli. That means this is an in vivo therapy. So it is more effective. Exposure therapy, it can be done in two ways. That is, one is in vitro and other is in vivo. In vitro I have already mentioned in systematic desensitization also. It's an imaginary feeling of exposure. Next one, in vitro, is a direct exposure to phobic stimuli. So under the previous research done, it is found that in vivo therapies are more effective compared to in vitro therapies. Next, I would like to introduce to you a concept called psycho-Vedic concept. So this hails from Indian medical science Ayurveda. We are combining the current psychotherapy concepts with Indian medical concept. That is psycho-Vedic concept. So it's playing a dual role. First, as a revival of authentic medical culture, the exercise of practice with the assumed primordial dimension. Second, as a discovery of an authentic subjectivity, the revelation of a self with an assumed interior depth. So that is the importance of this concept. So in this presentation, I would like to introduce all of you to a new concept, a holistic integrated therapy for phobic disorders. It's a combination of herbal medicine, herbal purification therapies, and relaxation therapies, including yoga, pranayama, meditation, that is mindfulness meditation, and JPMR, Jacobson's Progressive Muscle Relaxation Technique. Then psychological intervention, we are giving counseling therapies like CBT and behavior modification. So in this herbal medicine part, I'm choosing two herbal medicines. It's also from Indian medical science Ayurveda. First one is Bithania somnifera. It's a powerful antioxidant and immunomodulator. It improves strength, vitality, muscle mass, relieves stress. So it reduces most of the anxiety symptoms or stress symptoms. Next one is Glycyrrhiza glabra. This is a rejuvenated drug. It's usually uses for ADHD and some of the autistic conditions also. It's excellent antioxidant, immunomodulator, and antidepressant also, and memory enhancer also. So this is promoting life, vitality, voice, hair, completion, and strength. So these herbal medicines are scientifically studied and they are reported to be possessing varying degree of anxiolytic property and psychotropic activity. So that is why I chose these two medicines. Next one is a herbal purification technical therapy. This is also includes this Ayurvedic Indian medical science. Here we have chosen four, maximum five actually. Four therapies concentrating on the head area, and the last one is concentrating on nostrils actually. The first one is Talapoduchil. This is a certain Ayurvedic medicines or herbal medicines is made as a paste and applied as a poultice over the head area. That is Talapoduchil. It will be the total duration of the procedure maximum 45 minutes to 1 hour. Next one is Shirodhara. Certain herbal oils or medicated oils are poured as a stream to the head area. So this will be processed continuously, likewise doing 45 to 1 hour. Next one is Shirobasti. Certain kind of oil is put inside a cap, which is put around the head curvature. So oil is filled inside that cap, and it will be allowed to be there for 30 to 45 minutes. Next one is Siropiju. That is again dipping this medicated oil in cotton and keeping in the head area, mainly the frontal and parietal lobe areas. Then last one is Nasim. This is a procedure where oil is applied by putting drops via nostrils. So this is a procedure which is scientifically proven to be this Nasim. When you are applying medicine via nostril, it is reaching the blood-brain barrier. It's able to cross over the blood-brain barrier and cause a typical impact inside the brain and related organs. So that is the importance of this procedure. All these procedures should be practiced under the supervision of an Ayurvedic doctor only, licensed practitioner. So next we are going for the relaxation therapies. We used yoga therapy. As everybody is aware of yoga, this is an ancient holistic art of living. Physical, mental, and moral, spiritual fears is included. So here we are using simple sitting asanas. Asana means a sitting position only. So Sukhasana, Sthirasana, Vajrasana, Paschimottanasana, Shavasana, Padmasana, Bhujangasana. These are the asanas we tried. In the picture you can see one lady is sitting in Sukhasana and she's using the chin mudra and you doing the pranayama therapy. The same procedure they can use the Padmasana also or Vajrasana also. So this is the most soothing or relaxation providing asana or it's a relaxation procedure I would rather say. Next is JPMR, Jacobson's Progressive Muscle Relaxation Technique. It's developed by Dr. Edmund Jacobson in 20th century. He's a medical doctor, psychiatrist, and a psychologist. So currently we are using more for it's giving an ultimate relaxation to any patient or any condition. We are doing JPMR actually. So it creates a state of mental and physical relaxation. The technique is based on the idea that our mental and emotional state affects levels of muscular response, which in doing so illustrate the relationship between our muscles and our thinking and our relation, emotional relation. So essence of this technique consists of tensing certain part of the body and then immediately relaxing them. So like if you make the patient hold his wrist tightly, inhaling the air, holding the air also tightly, keeping maximum tension in that muscle in the wrist area, then slowly releasing the air and that time slowly releasing the muscle or removing that fist. So likewise, every joint portion we can do. This is one simultaneously we are relaxing certain group of muscles, relaxing breathing, tightening certain group of muscles, tightening the breathing. That is the way we are doing. Paying attention to the sensations of tension followed by relaxation helps a person experience a pleasant sense of well-being, which carry over to their emotional and mental state. Next one we use the technique is meditation technique. It's called mindfulness meditation. Mindfulness meditation is a mental training practice that involves focusing your mind on your experience, like your own emotions, thoughts, and sensations in the present moment. Being present, that is more important according to mindfulness meditation. It can involve breathing practice, mental imaginary, awareness of body and mind, and muscle and body relaxation. So administration is find a quiet and comfortable place, sit in a chair or in the floor with your head, neck and back straight, not stiff. Try to put aside all thoughts of past and future. Stay in your present. Become aware of your breath, focusing on the sensation of air moving in and out of your body as you breathe. Feel your belly rise and fall. Watch every thought come and go, whether it's a worry, fear, anxiety, let it go. So don't judge yourself. Don't ignore or suppress your feelings. Remain calm and use breath as an anchor. If you find yourself getting carried away in your thoughts, observe where your mind is. Without judging, simply return to your breathing. As the time goes to close, sit in a minute or two. Become aware where you are and get up gradually. So total duration of this procedure is per day 20 minutes. We will make the patient do it from first day to 21st day. That is 3 weeks continuously for 10 minutes. So it's highly efficacious. So the conclusion is this holistic integrated approach, which is based on the psychopathic concept, dealing with a combination of herbal medicines, herbal purification therapies, and relaxation therapies, including yoga, pranayama, and mindfulness meditation, and Jacobson's progressive muscle relaxation, along with psychotherapies like cognitive behavior therapy and behavior modification, is highly effective in alleviating phobic disorder symptoms. So this did this research work in my own clinics and we are providing these treatments to our patients for quite a long time. That is why I came forward with this presentation. I hope all of you are able to know the points and you're able to identify the importance of this phobic disorder treatment. Thank you. Hello.
Yes, Ramya, that was a great talk. The information you shared was really helpful to the audience.
Sorry.
That was a great talk, Ramya. The information you shared was really helpful to the audience. And
Thank you.
we have a few questions from our audience. We will drop it in your email. Please answer them.
Okay, right now you want to answer or you want me to mail the answer?
We will mail you.
Okay, I will reply the answers.
Yeah. Thank you so much.
Thank you for giving me an opportunity. Thank you.